Okay, everyone, if we could get your attention and find your seats for this, the last panel for the day, I'd appreciate it. So we're going to be next talking about some of the tobacco treatment, smoking cessation considerations with regard to lung cancer screening implementation. I have just a couple of slides to kind of get us rolling to kind of cover things so that our speakers don't have to address this. But virtually, we have almost unanimous support for the inclusion of tobacco treatment across most of our established guidelines, but there's some wrinkles that include some calls for additional research that I think we need to address, the referencing of our tobacco treatment and dependence clinical practice guideline, but we also have a number of different iterations, lots of questions yet to be answered in terms of how best to do this. And so to some extent, we hope to, with this panel, to kind of clarify what we know and to launch off into directions that help us to help programs implement optimal strategies. You can see that from the Peter Mazzone's work and his group that you can see that the smoking cessation is a vital part of the quality of lung cancer screening programs, that indeed we have studies documenting the cost effectiveness of adding on tobacco treatment strategies into the lung cancer screening context, that while they do not necessarily fare as well as direct tobacco treatment independently, but that's a separate question, but hopefully supporting the inclusion creates opportunities. And I think we need to remember that most of the data that we have is observational at this point, with people participating in lung cancer screening and either spontaneously quitting without much assistance or continuing to use tobacco. We do have the stalwart that we have, the Treating Tobacco Use and Dependence Clinical Practice Guideline, but you also need to know that a couple of professional societies, SRNT and ATTUD, have recently come out with a very nice review with some interesting thoughts and comments on what we know about integrating tobacco treatments into the lung cancer screening setting. And as well as we know that it's important because our colleagues at the National Cancer Institute have initiated this RFA, and which I am told by Stephanie that decisions will be made in a couple of months or so, and hopefully launching out and creating new opportunities to learn about the best strategies for integrating tobacco treatment and really creating this teachable moment and utilizing that to reduce risk of lung cancer. Importantly, in terms of the theme of thinking about this population as unique, we know these are older tobacco users, and sometimes there's some pessimism associated with helping individuals who are long-term tobacco users, helping them achieve cessation. But indeed, we have a couple of reviews in the literature that have supported the value of this, the efficacy of interventions with this population that might create some difficulties, of course, with this unique population, but indeed that it is a worthwhile effort, and I think Chris may mention some of those as well. So I want to introduce our panelists. We have Dr. Chris Slator, who is with the Portland VA and who's vitally integrated into the work on this by virtue of conducting some systematic reviews of the literature that's available in terms of informing some of our guideline development efforts. Elise Park, who has been very involved in tobacco treatment efforts in lung cancer screening, as well as lung cancer caregivers or lung cancer survivors. And we'll be talking about screening and resistance to cessation efforts through some of her work with the NLST. And then Kate Taylor is professor of oncology at Lombardi, who has data from an actual clinical trial addressing this question that she can report to us today. And then finally, Jamie Ostroff from Memorial Sloan Kettering is going to discuss some perspectives on readiness and capacity of screening sites to implement smoking cessation. So looking forward to the panel, and I will turn it over to Chris.